Let's talk about hospitals. Because Washington talks about cutting waste, but no, they're cutting hospitals. Your hospital. Because when they passed that big, beautiful bill last week, the funding cuts are going to lead to hundreds of rural hospitals closing down nationwide. That's not just a statistic. That's someone's ICU. That's your ER. That's someone's parents' cancer treatment facility. That's a pregnant woman's maternity clinic. Those are all gone. They say it's about saving money, but they're still handing out billions of dollars to big oil and billionaires. How is it fiscally conservative to hand out billions of dollars to the billionaires while rural America loses health coverage? This isn't policy. This is a hit job for those who can't fight back. They lied to us, and next election cycle to vote them.
This time last year, the residents of Unicoi County, Tennessee were still proud of their 4-year-old hospital, Unicoi County Hospital, which had been built by Ballad Health in 2018. And then Hurricane Helene hit. And 2 days after it made landfall, 54 staff and residents of the hospital, including about a dozen rescue staff that had come on fast boats, had to be airlifted via helicopter from the roof of the hospital. And the hospital is yet to rebuild. The estimated cost to rebuild it is now in excess of $50 million. And FEMA and the state of Tennessee have contributed about $9 million. But thanks to the massive Trump bill that just passed, well, it now looks like the hospital won't be rebuilt, leaving Unicoi County residents without a hospital. And Ballad Health, that operates more than 30 rural hospitals through Tennessee, North Carolina, and Virginia, is now saying by the end of 2028, they'll likely be losing $125 million a year, where they had just begun to operate in a $30 million a year operating profit that they were turning towards opening more hospitals in rural communities. Thanks to the Trump mega bill, more rural hospitals are going to continue to close, and this story is going to be repeated around the nation, particularly in red rural states.
You're a hospital and see how the Big Beautiful Bill Act affects you. You own an average run-of-the-mill hospital. 2 patients come in and they both need emergency medical care. One patient has commercial medical insurance, the other one does not. The care for both patients costs $2 each. $2 for patient 1 and $2 for patient 2. For patient 1, you go to their commercial insurance payer, you negotiate, you get your $2 back. Patient 2 can't pay the $2, but because the government knows that they're living in poverty, they agree that they are going to pay you, the provider, the $2 on the patient's behalf. The costs are $4. You have $4 in your hand. Now, let's say the government says, you know what, we're actually not going to pay for some of these patients. So the next time when the 2 patients come in, your cost as the doctor is $4. Now, you get $2 back from the commercial insurance payer, but these other $4, the government says, we're not paying that. So what do? You go back to patient 1 and you say, hey, unfortunately, I'm going to need $4 from you, patient 1. Even though your care only costs $2, I'm going to need $4 because I need to cover all of these costs. Now, let's take this a step further and assume that you, Dr. Jean, you are a doctor who owns a rural hospital instead. So now, instead of half of your patients having commercial insurance and half being under the poverty line, now both patients are under the poverty line. So now the same 2 patients come in and they both need emergency care worth $2 each. Now you don't have a commercial insurance to bill for any of this. And also the government said, hey, we're not going to let you bill us for this either. So what do you do with your $4 costs? Nothing. You can't pay your doctors. You can't pay your bills. And so eventually these $4 build up and you close. Not patient 1 and patient 2 who had to come to you for emergency medical care, except now that you're closed, now they have to go somewhere else, somewhere further. If they make.
Guys, just imagine waking up in a small town where the nearest hospital is miles away. Now, just imagine it shuts down. And for people in rural areas, this is not just a worry, it's their reality. Hey, beautiful people, welcome to my YouTube channel. Thank you for stopping by. All credit goes to the creators in this video. So, guys, the access disappears. Proximity to routine checks, emergency care, maternity services, even vaccinations will become difficult or nearly impossible because We don't know how a simple healthcare issue can quickly escalate until you have to drive miles and miles to get that simple healthcare resolved. Okay, it can just escalate into a life-threatening emergency, and people cannot afford the long trips to urban hospitals. Rather, I mean, especially the elderly ones. Imagine those without cars. Imagine those that cannot take time off work. I mean, just imagine those without cars. I mean, many of these elderly people, they can just take a short walk to the hospitals. Imagine they're having a heart attack, stroke, even childbirth complications can happen, right? What if somebody wants to give birth and there's a complication, and then you have to drive so far away? These communities will suffer because the hospitals are not just places for treatment, they are lifelines, and major employees are there, because losing a hospital will just mean losing jobs. People will lose their jobs, and there are fewer local businesses, guys. And the ripple effect, schools, local businesses, emergency services, all these people will feel the effects, because healthcare is not just the backbone of a community. Without healthcare, the entire town will struggle to survive. Guys, let me know your thoughts in the comments. Let's see what these other creators have to say.
A super rural area in Illinois, and recently our local newspapers have started posting about hospital closures and how Medicaid and Medicare funds our hospitals and our nursing homes, and how there's a lot of fear surrounding Medicaid and Medicare cuts and possible job loss, possible department closures, things. And there are like about 100 MAGA in each post, and they're just like, show me the data, I want to see the numbers, show me the financials. Like, they'll understand it. It's just so comical to me. They are telling you, we have already closed our OB department, we have already closed this clinic and that clinic. People are already driving an hour to an hour and a half for healthcare, especially women's healthcare or mental health. People are still in disbelief, like the newspapers, oh, you're just a liberal newspaper, look at you've gone woke. It's not woke in a bad way to understand how these cuts and these policies impact us, especially in rural areas. Like, you have to wake up and face reality at some point that you voted for this, and now you're going to be impacted. Your neighbors, your friends, your family, we're all going to be affected by this. It's your fault. You have to open your eyes and realize that. You can't just live in denial. They're telling you they're going to close. When they close, are you still going to be in denial? No, you're going to blame it on Democrats somehow.
So I just read an article that caught my eye because it's in an area, well, a state that I used to live in. I used to live in northwest Nebraska, like 12 miles outside of Pine Ridge Indian Reservation, which is in South Dakota, because I worked up there. And this little town is called Curtis, Nebraska. They're losing their hospital. They just flat out said, we're shutting her down. Why? You already know why. So this town is less than 1,000 people. They're losing their hospital. They are more than an hour each direction to a major hospital. And those towns, maybe double the size that they are. So they're not real big hospitals, but they are larger than that. But even still, those hospitals may be on the chopping block. So if you've never been to the western part of Nebraska, it's pretty sparse out there. I feel for these people. Then when I looked up how they voted, sad situation.
Medicaid cut is going to be absolutely devastating, guys. Rural hospitals all across the country are already on life support, and this bill is basically pulling the plug. They are not just trimming around the edges. They're gutting Medicaid funding, and rural hospitals rely heavily on Medicaid reimbursements just to survive. It's not just for people who are on Medicaid. These cuts affect everyone, because when a hospital shuts down, it shuts down for everyone. Doesn't matter if you've got private insurance, Medicare, or nothing at all. If the ER is gone, it's gone. In Nebraska, there's already a rural hospital planning to close, and they're being honest about why. It's because of these anticipated federal cuts, and it's not just one. Over 100 rural hospitals have already shut down in the past decade, and hundreds more are on the brink. This bill could push dozens, maybe even hundreds over the edge. And people don't realize how much damage this does to a town. The hospital's not just a place for emergency, guys. It's where babies are born. It's where cancer gets caught early. It's where your kid goes when they break their arm. It's one of the biggest local employers. It supports pharmacies, nursing homes, ambulance services. When a hospital closes, the entire local economy takes a hit. The whole community suffers. And let's be clear, this is not just about weeding out undeserving people. That is bullshit. These cuts hit working families, elderly folks, people with disabilities, veterans, kids. And even if you don't have Medicaid, your hospital might still close down because it can't survive without that funding. This is what happens when you let politicians treat human lives like budget lines. They're not just cutting costs, they're cutting access, cutting jobs, cutting lives short. People are going to die because they won't be able to get help in time. That's not dramatic, that is reality. And pretending it's anything else is just cowardly and ridiculous. And yeah, this bill might pass in the next day or two, but we better remember every single fucking name that signed off on it, because once these hospitals are gone, they're not coming back, and neither should the people who voted.
That's the sad reality. Some people actually voted for this, thinking it will reduce government spending, or thinking it will streamline healthcare, or thinking it will modernize the system. And the problem is that these rural hospitals depend heavily on Medicaid funding. And when this bill is cut, they cut, what am I even saying? It's practically being cut. They are not just abstract. They will directly remove the financial lifeline that these hospitals need to operate. And some of the people that support this bill are saying that the bill focuses on efficiency, it focuses on long-term healthcare reform. There is nothing like long-term healthcare reform, because sicknesses and diseases do not wait for long term. Anything can happen at the heat of the moment. So some say the result is short-term devastation. Okay, so are you saying that some people have to be unalived knowingly, right, because of a long-term, like, I don't get it. Make it make sense in the comment section. Or am I the one that is not getting it? Hospitals are closing, communities are losing care, patients are left stranded, and you are saying we have to suffer now in healthcare. I mean, the lifeline healthcare. We have to suffer now to enjoy later. Like, are we even sure of the enjoyment later, guys? Actions have consequences, and sometimes those consequences are life and unalive. Let me not mention that.
She saw that in Indiana there are 12 rural hospitals projected to close due to the big, beautiful bill. Is that correct? Yes, unfortunately is correct. 12 rural hospitals are expected to close in Indiana. Is Indiana a red state and voting for Trump? Yes. Did Indiana vote to spend money on military and deporting brown people? Yes. Is Indiana going to learn a hard lesson because they are a red state? 12 rural hospitals are going to close. Also, millions of Americans are going to be cut off Medicaid, SNAP benefits, which affect red states the most. So is Indiana getting what they voted for, like Texas and this tragic flood? Like farmers, cattle ranchers, coal miners, truckers, federal workers who voted for Trump, Latinos who voted for Trump, Cubans for Trump, Venezuelans for Trump, Haitians for Trump, Mexicans for Trump. Yes, they're all getting what they voted.
Cuts to Medicaid threaten hospitals in so many rural communities that so depend on them. This bill puts hospitals at a disproportionate risk of closing, cutting services, and ending inpatient care altogether. Remember, rural hospitals and healthcare systems make up about 35% of all the hospitals in America. Hospitals are also a reliable source for employment for millions of Americans, especially those in rural communities. Hospitals provide nearly 1 in every 12 jobs. This big, beautiful bill will devastate healthcare in communities where it's already the least accessible.
Guys, it seems that we all talk and talk and talk and talk and talk about all these things. But in actual fact, what can be done? Because it seems that we are all airing our opinions, we are all airing our thoughts, and there is no action. Like, it's tiring and it's frustrating because it's not just about hospitals, it's about people, it's about your neighbor, it's about your friends, it's about your family, it's about communities that actually make up the earth of this country. Because every closure that happens in all these rural hospitals is a warning. Each rural hospital that shuts its door is a life at risk or a life that has been unalived. A town that is struggling to survive, right? And a future that suddenly feels unknown, uncertain. We don't even know, because these decisions affect people in real life. People that cannot just jump into their car, and drive to a nearby big city hospital. You feel me? Pregnant women, children, toddlers, babies, elderly. Guys, let me know your thoughts in the comment section, because it just looks to me like we are just looking, and letting all these things happen, and we feel that we should know, we have things to say, we have opinions, but it's like it's not even getting to anywhere. Guys, do we speak up and fight for the people who cannot fight themselves? Or do we just watch by and let these communities lose their hospitals? Guys, this is so sad and disheartening. Let me know your thoughts in the comments. If you have found value in this video, don't forget to like, share, and subscribe. And I'll see you in my next video. Please stay safe. Mental health is important. Ciao.